Well, thanks everyone for joining us for our webinar today. Veterinarians Without Borders would like to start with the land acknowledgement. So we'd like Veterinarians Without Borders, board members, staff, volunteers, donors, and supporters live and work on the traditional territories of many Indigenous peoples across North America. The traditional stewards of these lands who have been living and working on them for thousands of years. Our head office is situated in the unceded and unsurrendered territories of the Anishinaabe Algonquin people whose presence reach back to time immemorial. My name is Kristen Rodrigues. I'm the Director of International Programs here at Veterinarians Without Borders, and I'll be the host for your webinar today. As you may know, today is November 3rd, and it marks One Health Day, an annual worldwide campaign to bring attention to the essential interconnection of human health, animal health, and environmental health. Because One Health is central to the work of Veterinarians Without Borders, I'm pleased to host a discussion with a multidisciplinary panel of One Health specialists and colleagues. We hope this conversation will demonstrate how complex health and social issues can benefit from a collaborative, holistic approach such as One Health. So during this webinar, we encourage your active participation. And after all of the speakers' presentations, we'll open up the floor for a question and answer session. So you can wait until the question and answer session to submit a question, but also feel free to submit the questions during the presentation as well. And we'll do our best to address all of them during the question and answer session. So to begin with, I'll start with just a little introduction on One Health, and then we will introduce our speakers and go from there. No. Okay, so One Health, for those who are unfamiliar, is a concept and approach that recognizes the interconnectedness of human health, animal health, and environmental health. One Health has gained recognition and importance in addressing emerging infectious diseases, as well as the ongoing threats posed by diseases that can be transmitted between animals and humans. So this approach promotes collaboration and communication amongst various disciplines, including medicine, veterinary science, ecology, environmental science, and public health. And so it uses all of these disciplines to address complex health issues at the intersection of these domains. So this approach is considered vital for safeguarding public health and the health of ecosystems in an increasingly interconnected and globalized world. So before we dive into some presentations, I would just like to highlight a few key principles of the One Health approach. The first being interdisciplinary collaboration. So a key aspect of One Health is that it does encourage experts from different fields to work together to tackle health challenges that involve multiple species. So specifically, one such example would be zoonotic diseases, looking at those that can transfer from animals to humans. Another key principle is a holistic perspective. So One Health recognizes the need to consider the entire ecosystem and its impact on health. Changes in the environment, such as deforestation or climate change, can influence the spread of diseases and the health of both humans and animals. Another key component is the preventative measures. So One Health approach promotes the prevention of health issues at their source, rather than merely treating the symptoms. So this includes surveillance, early detection, as well as intervention. Finally, the One Health approach has a global perspective. So many health challenges like emerging infectious diseases are global in nature. And the One Health approach acknowledges the importance of international cooperation and information sharing to address these challenges effectively. So the purpose of our webinar today will be to explore the One Health concept and its significance to international development. And to do so, we have specialists from diverse fields to help us. The first being Julie Truelove, who's the head of policy and advocacy at WaterAid Canada, and she'll be speaking to how water, sanitation, and hygiene services and water security have an important connecting role to play across human, animal, and environmental health. Then we'll have William de Glanville, our animal health and zoonotic technical advisor here at Veterinarians Without Borders, who will be speaking about animal health system strengthening and the opportunities and challenges and the importance of the One Health approach. And finally, we'll have Dr. Regan McLeod, an associate veterinarian at the Highview Animal Clinic, and she'll be speaking to the impact of One Health on day-to-day practices in veterinary medicine and her experiences working as a veterinarian with Veterinarians Without Borders in our project in Vietnam. So without further ado, I would like to pass it to Julie Truelove. And Julie is, as I said, the head of policy and advocacy at WaterAid Canada. And she is a water, sanitation, and hygiene specialist focused on policy, advocacy, and program development with WaterAid. She has collaborated extensively with civil society to position WASH as a pathway to gender equality and empowerment of women and girls across Canada's feminist policy and water security for climate resilience. Julie holds a Master of Science in Water and Environmental Management from Loughborough University and an Honors Bachelor of Science in Physical Geography from Carleton University. She also holds a certificate in Integrated and Adaptive Water Resources Planning, Management, and Governance, and is a recent professional development in ecosystem approaches to health with COPE Canada. So now I would like to pass it over to Julie Truelove.
There we go. Sorry about that. Can you see my slides?
Yes, we can see them.
Okay, great. So hi, everyone. Thanks very much for bringing the discussion together. It's really, I'm interested to learn from everyone today as well. Certainly for myself and for WaterAid, we're really coming at this as people who are learning about One Health and learning where we can apply what we already do in water sanitation in a One Health approach. And so very eager to learn from the conversation today. I think I'd also just like to acknowledge Dr. David Masoki at Makerere University in Uganda, as he's someone who introduced me to much of this work several years ago. And it's taught me a lot in this field. So I'm looking forward to sharing some of that with you. So in case you're not familiar with WaterAid, it's a global federation in about 34 countries, working in water sanitation and hygiene for focus on basic human needs for WASH primarily. Those are our links to our strategies if you're feeling so eager to dig into that. We have 4 strategic aims around universal access to WASH, improving public health, climate resilience, and financing for WASH. And that's embedded in a system strengthening approach, as you can see in the outer rings. So when we've been exploring this, we're really looking again at WASH for basic human needs. So it's the center of that circle that you see there. And so while we're focused on that, though, we recognize that WASH sits within this much broader ecosystem of water resources, sectors, industries, economies, and such. And so it's that interface between basic human needs and these other large water using sectors that really is increasingly becoming part of our dialogue in what we do. And so we do see WASH as WASH, water sanitation and hygiene. I'll probably flip back and forth with the language, but when we see WASH as this connection to the environment with our health, with animals and ecosystems. And so there's a lot to dig into there. And what we've looked at so far in mapping our existing work in a One Health approach, we see some possibilities, I guess you could say, There's a lot of work around WASH and neglected tropical diseases, which is top of mind, obviously. Hygiene behavior change, it also sits in the center of these interactions between people and animals and ecosystems. And ending cholera is another one where it's a fundamental part of WASH, in terms of facing the vulnerabilities that people have and vulnerabilities to cholera, and we'll talk a bit more about that further on. Climate resilient WASH and water security, again, is a big area for us. Sustainable sanitation at scale, it's again something we've not achieved yet. And WASH in healthcare settings, including waste management and cleaning, and those links to AMR. These are all things that we can see the potential in what we do already, but also recognizing that we have a lot more to learn on this. So then just some basic definitions, I guess. Again, this basic human needs is in the center of the circle. But then when we talk about water security, water security really depends who you are, where you are, and what you need water for. And so it's really some different conversations between the two in some respects. And it's those hazards related to climate change, the vulnerabilities that people have. It speaks to the social determinants of health to some degree, in terms of whether people are considered water secure or not. And so increasingly as well, we're talking about climate resilient WASH. And so what are WASH systems that can bounce back from shocks, from climate induced events and things like that. So if you ever questioning what the definition is, come back to these circles, and that's a good way to think of it. So then I think we really want to focus on, from our perspective, on strengthening this environmental health pillar of One Health. You know, we see the climate crisis is often considered a water crisis as well, because there's so many implications for climate-induced hazards, you know, manifesting in changes in water sources, water-related events, and disasters and such. And so when we look at this WASH for basic human needs, what is the interaction with climate? And we're figuring that out. So the pathways, I think the pathways are pretty familiar to most in terms of rising global temperatures, these extreme events, flooding in particular in this instance, rainfall uncertainty, sea level rise, all of those things have implications for water resources. And so what is having strong WASH systems that can be resilient to that is one of the key areas that we need to consider. And that's really where we're looking at multi-sectoral approaches across these systems. We know increasingly there's a tension on climate, the climate health nexus, to call it that. What do we know and we don't know? There's lots to learn around that, but we have the first ever health day coming up at COP28. And so there's a lot there that WaterAid is certainly paying attention to, and we see a role for WASH. The policy landscape for building on One Health is really increasingly strong from what I can see from the pandemic treaty, and then also the global biodiversity framework that came about a year ago in Montreal at COP15. But putting those things into practice versus the policy, it's how do we operationalize those things is really, really critical. So this WASH system that I was referring to, I don't want to spend too much time on this, but this is where it's all the actors and factors that we see that affect the outcomes for WASH. So it could be financing, it could be NGOs, it could be government, you know, human rights based work. There's all of these components have to act together, because WASH doesn't sit in one line ministry in government. It sits across health or sometimes education or public works. And so we're already working in this multi-sectoral approach that really applies well, I think, to the One Health principles. So these lessons learned, I guess we see water security, there's many elements of SDG 6, hygiene, sanitation, that can have an encompassing role across the three pillars of One Health. And again, this multi-sectoral collaboration and coordination, which is easy to talk about, really difficult to do in practice. So we really see some benefits to learning from the WASH sector, bringing that to the table. But we also acknowledge the limitations of it. We're only one piece of a much bigger puzzle. So it comes down to as well those, you know, how are these components interacting together? What could the WASH sector bring to the table more strongly? who might be missing at the table around an enabling environment to get water security and WASH as this connector in a One Health approach. So there's a lot to dig into as we move forward in our learning on this. There's a couple of examples I wanted to just touch on briefly that, again, these are sort of aspirational ideas that we see from the work that we're already doing, and how could they be reimagined in a One Health approach. Certainly a big one is the hygiene behavior change response to COVID-19. This was something that was a huge piece of work in our hygiene behavior change portfolio, and the use of behavior-centered design in hand washing, hygiene promotion in transportation hubs, public markets, all of these places, which again, we see that in the center of these interactions of people and animals and the environment. Again, NTDs, it's another element of this that obviously is very applicable with the zoonotic disease components as well. Ending cholera, this really brings in an inequalities lens. Cholera is not always considered in the One Health dialogues, but the characteristics of cholera outbreaks seem to be very applicable or the One Health approach would be very applicable in the characteristics of cholera outbreaks, which we see are increasing with climate change as well. There's ongoing research around that that's happening. And again, we know that water sanitation and hygiene is really a vital long-term prevention measure in cholera that we've not yet succeeded in preventing that. And it's this inequality factor that really speaks to people's vulnerabilities in different countries. And this part on water security, again, depending who you are, where you are, and what you need water for, this is increasingly a really important area of work for WaterAid in terms of building climate resilience, because it speaks to WASH, but it speaks to that wider water security lens. And so how are we building and promoting multiple use systems? Is it meeting the different needs of people? Are we mapping out water resources appropriately? That also connects further to integrating integrated water resource management with WASH more closely. You would think that that happens, but it doesn't really always happen. So how can we better identify water-related threats through that intersection of the multi-sector approach there? And also accelerating efforts to strengthen healthcare facilities with WASH, build resilient health systems, and then again, that more equal access to quality care. The behavior science piece of this is quite interesting as well in terms of behavior change and climate adaptation. There's a lot to be learned there in terms of adapting, and what does behavior science have to say about how we adapt to climate change. So reducing those climate risks, addressing inequalities, increasing water security, and that collaboration piece. To us, we see those all as pathways for water sanitation and hygiene in a One Health approach. Just a few closing pieces on a bit of a call to action. I think these are the things that stand out to us in terms of, again, learning from these existing efforts on WASH. WASH exists in some global roadmaps around ending cholera, NTDs, hand hygiene and such. So what can we learn from those roadmaps from the WASH sector? Leverage this increased focus on the climate health nexus for environmental health and this environmental health pillar of One Health. How do we advocate for financing mechanisms that are fit for purpose for this? Because right now, getting multi-sectoral financing is a big challenge. And so what is fit for purpose in these cross-sectoral engagements and funding them properly? Seeking out non-traditional partners, whose knowledge counts in the evidence. We talk about Indigenous traditional cultural knowledge and experience, but ultimately whose voices are at the table for decision-making is really critical. And lastly, just urging that climate justice and equitable WASH and water security, it's that inclusion in addressing vulnerabilities, because there is this disproportionate disease burden that's only increasing, I think, in the days of climate change as well. So I think there is some resources that I can share on the last slide if we share the slides afterwards, but I'll stop there though. Thanks.
Great, thank you, Julie. And just a reminder for all participants that if you have any questions, please put them in the question and answer box, and we'll come to them after the 3 presentations. With that said, our next speaker is Dr. William de Glanville. He's our Animal Health and Zoonotic Disease Technical Advisor here at Veterinarians Without Borders. Will is a veterinarian and a public health scientist who has worked on a range of human and animal health issues in Africa and Asia since 2008. In addition to earning his honors degree in conservation medicine and veterinary medicine, he completed a residency in veterinary public health and has a master's and PhD in epidemiology. Before joining Veterinarians Without Borders in 2023, this year, he worked at the Royal Veterinary College in London, the University of Glasgow, and the International Livestock Research Institute, and for Médecins Sans Frontières. He's passionate about strengthening human and animal health service delivery in neglected populations. So with that, I'll pass it over to Will for his presentation.
Thanks, Kristen. Okay, got it. Okay, sorry for the bit. Can you see my screen? Okay, great. Thanks, Kristen, for the introduction and for organizing the session today. So in my talk, I'm going to give some personal perspectives on some of the challenges and opportunities that I see around strengthening animal health systems, and then talk a little bit about some of the areas that Vets Without Borders is working in this area. But just before I start, I think it's important to recognize that there are hundreds of millions of livestock keepers around the world. And of course, most of them live in rural areas. And most rural areas in the global south, in low and middle income countries, can be characterized as areas with high levels of poverty. And indeed, it's estimated that something like 75% of livestock keepers in sub-Saharan Africa live in extreme poverty. So livestock in these sorts of environments have a really critical role to play in human health and well-being. So they can act as a source of assets that people can use in times of need, for example, to pay a medical bill or funeral expenses, or to pay for school fees. And they also act as a vital source of nutrition, providing milk, eggs, meat, which is particularly important for growing children in many of these environments. So given the importance of livestock, it's clear that good livestock health is a prerequisite for global health, for economic development, for food security, and for poverty alleviation. And I would argue that strong animal health systems that can support livestock health is a key step on the path towards achieving the Sustainable Development Goals, which Julie has already mentioned, and livestock health fits into many of these. So there are massive opportunities for strong and effective animal health systems to contribute to important targets like the Sustainable Development Goals. But unfortunately, at the same time, animal health systems are undervalued, they're underfunded, under-resourced, and in many countries, we could probably say they've been marginalized for decades. So there is an enormous need to improve the capacity of animal health systems to meet the challenges of the world. So I've been talking about the potential contributions of livestock to alleviating poverty, but we could make the same arguments around climate mitigation, around tackling the risks of AMR, or around preventing the next pandemic. And one of the central messages of the Sustainable Development Goals is one of universality. So the idea that the Sustainable Development Goals cannot be considered to be achieved unless targets like no poverty, zero hunger, good health and well-being for all are achieved by all. So is this concept of leaving no one behind. So given the importance of livestock health in achieving targets like the Sustainable Development Goals, it's important to ask the question, how can we ensure that the poorest livestock keepers can access quality and affordable animal health services? And I perhaps restructure that question in a slightly more challenging way and ask, how should animal health services be structured or indeed restructured so that they can reach the poorest livestock keepers? And for me, this is really one of the most pressing challenges facing the veterinary sector, particularly in the global south. But I think that the momentum that has grown around the One Health approach creates new opportunities for addressing these challenges and answering these questions. So, of course, we, as Kristen mentioned, highlighted at the start, we can use a One Health approach for advocating for the need for investment in animal health systems. And as both Kristen and Julie talked about, we can use the One Health approach, the One Health framework, to bring in multidisciplinary and cross-cutting perspectives in order to strengthen animal health systems. And of course, there's not one type of animal health service, and we're going to need a range of different approaches in order to support the full range of animal production that exists in countries in the global south, and that ranges from the kind of life, the sort of subsistence systems that I talked about at the start, right through to commercial producers with very large numbers of animals. But for me, one of the key cross-cutting issues that we in the global veterinary community need to learn, and to learn particularly from the human health sector, is that without clearly identifying approaches to include people who are poor from the beginning, drives to reach all people with any sort of health delivery are very likely, perhaps almost certain, to leave the poorest behind. So I wanted to make the case today that whenever we are developing or improving animal health service delivery, we should always keep this second question in mind. How can animal health services be structured so that they reach the poorest livestock keepers? So for the remaining time, I wanted to highlight one tool that is available to us for meeting some of the animal health needs in remote and rural communities, and that is the community animal health worker model, which is a model that Vets Without Borders supports in communities that have particularly limited access to animal health services in countries around the world, in Africa, in Asia, and also in northern Canada. So this is a model that is entirely community-based and community-driven, and it involves working with communities to identify their main animal health constraints and needs, and then the community themselves then select members of that community to receive training, specific training on how to address those particular animal health needs and constraints. And by strengthening livestock keepers' existing knowledge, and many livestock keepers in these settings do have extremely good knowledge on livestock diseases and how to manage them, by strengthening that existing knowledge on how to diagnose livestock disease and to use tools like vaccination and modern medicines for the right disease, at the right dose, and for the right duration. These community animal health workers can help their communities to reduce livestock disease and morbidity and mortality through both prevention and treatment, while also reducing misuse of antimicrobials. And they can also contribute in a whole range of additional ways, including through surveillance, which Kristen mentioned at the start, which we can talk about some more if that would be helpful. So those interventions that I mentioned are quite technical, involving vaccines and modern drugs. But a key role for community animal health workers and something that we seek to do in wider programming is supporting communities with human behavior change in order to improve human and animal health. So this is picking up on what Julie has already said on the importance of behavior change, because a lot of what we do is around awareness raising. So we advise community animal health workers and livestock keepers in the community around simple biosecurity practices like separating sick animals from healthy animals. We advise community members on ways that they can reduce their zoonotic disease risks, for example, by boiling milk before consuming it. But of course, just giving people knowledge is not necessarily enough, and that I think that there tends to be a perception that these kind of awareness raising activities are quite easy interventions. You give people the information that they need in order to change their behavior, and then they do it. But in reality, I think it's a lot more complicated than that. And of course, behavior change is influenced by people's awareness, but also their capacity to make change, the opportunity to make change, and also their motivation to make change. So this is the second point where I want to really make the case for the importance of a strong One Health approach that brings perspectives and tools from multiple sectors and disciplines, because what we need are people who have technical knowledge, who can identify potential interventions that can reduce disease risk, and then to, as Julie highlighted, to then work with people who understand how to drive behavior change, and also, as Julie mentioned, to work with communities to understand what will and will not work. So I just wanted to finish with an example, because it's something that we're discussing quite a lot here at Vets Without Borders, and it's one of the areas that we're seeking to raise awareness in the community we work in, is around the risk to maternal health that can arise from livestock zoonoses. So many livestock zoonoses cause spontaneous abortion in livestock, and unfortunately these diseases can have the same impact in pregnant women. So a pregnant woman who is assisting an animal that is aborting, or perhaps delivering prematurely due to a disease like brucellosis, is at high risk herself from acquiring that disease and having the same health issues, so potentially miscarriage or preterm delivery. And so for this reason, most countries have recommendations that pregnant women should not assist livestock when they're giving birth, and in particular that they should avoid livestock abortions. But for many of the communities that we work in, just providing that information doesn't really go far enough, because in many of these communities there may be cultural expectations around dealing with livestock disease, and particularly reproductive issues in sheep and goats. That there's often a perception that is women's work, and it is how to change that cultural perception. And or it may just be the case that there aren't people around who can fill that gap and take over those jobs to support pregnant women. So in addition to providing the information, we need to work with communities to co-develop locally appropriate strategies that can reduce risks for particularly vulnerable groups. And clearly, this requires inputs from disease experts, from social scientists, from gender experts. It requires a One Health approach. So just to finish and to summarize, why is the One Health approach important for animal health system strengthening? I think we could talk about this all day, but just to raise these 3 points, we can use it as a source of advocacy to highlight the importance of animal health for human health, for environmental health. We can use it as a framework for bringing cross-cutting perspectives on how to deliver equitable animal health system strengthening. And we can increase the impact of animal health systems, for example, through more effective behavior change. Thank you very much.
Great. Thank you, Will. And so again, just a reminder, if you have any questions, please enter it into the question and answer box. And if you don't know how to do that, you can also enter it in the chat, and we'll address those following our last presentation. So with that, I would like to introduce Dr. Regan McLeod. She's an associate veterinarian at Highview Animal Clinic. Regan is a veterinarian and mixed animal at a mixed animal veterinary practice, in High River, Alberta, and she received her Doctor of Veterinary Medicine and honors of Bachelor of Science from the University of Calgary. She recently completed a volunteer placement with Veterinarians Without Borders in Vietnam, working alongside the Institute of Environmental Health and Sustainable Development. Her placement supported Veterinarians Without Borders' 7-year project. Vets, also volunteers engaged in gender responsive technical solutions. And in her role, she collaborated on projects related to antimicrobial resistance and aided in developing a training program for small-scale poultry farmers on biosecurity and disease management and prevention. So with that, I would like to pass the floor to Dr. Regan McLeod.
Thank you. Okay, can you see my screen there?
Yes.
Yeah, okay. So thank you for having me today. I'm excited to be here and talk with One Health about all of you. And thank you both, Julie and William, for your presentations. They were very, very good. So I'm going to talk a little bit about veterinarian and what kind of One Health means to me, kind of in my day-to-day practice as a veterinarian. And then I wanted to talk a little bit about my experiences with Vets Without Borders when I was working in Vietnam. So kind of to get started, so what is, we've looked at One Health and we know it's this multidisciplinary approach that incorporates all these different fields. And so I'm going to focus a little bit more on the animal healthcare aspect because that's the area that I work in and what that looks like. So when we look at the role of a veterinarian, a lot of people often think of veterinarians as, looking after cats and dogs and doing that primary care. But there's a huge aspect of it that, there's multiple parts that veterinarians do. So we can look at things like we do preventative medicine, disease diagnosis and treatment, but we're also hugely involved in disease surveillance. And so often, especially as a mixed animal veterinarian, we see large groups of animals, and so monitoring them for diseases that are circulating kind of in that herd, but also for me right now, because I work in southern Alberta in the province. Veterinarians are also hugely involved in food safety. So, being able to be aware of making sure that those animals that potentially might end up in the food chain are safe for human consumption is extremely important. In that a lot of that
role falls on veterinarians to make sure that they're educating, the people who own these animals on what's appropriate to do and what appropriate health of an animal might look like. And then veterinarians are also highly involved in things like research and development. So being involved and being aware of, what new products and drugs are coming out, but also in terms of, how animal diseases, what new animal diseases are emerging, what the new information is out there, but how that impacts human and animal health is also a really important aspect of it. And then looking at outbreak management and disease control. So oftentimes we can see, disease outbreaks in animals, just like we can see them in people. And so veterinarians kind of on that animal side step forward to help kind of control and maintain that disease, those disease outbreaks and help kind of get them under control and treat those diseases. So when we look at veterinarians in One Health, we often think kind of that one aspect that I often think of first is zoonotic diseases. So, identifying and treating their patients with zoonotic diseases. But the important part is to also educate owners and the public as well as to what, these diseases look like and how they can spread to people through their environment and through things that they're contacting. So, for example, things like ringworm in cattle can be quite common. And if you're handling cattle quite frequently, you can end up with lesions yourself. And a lot of times that's not really aware that that disease can spread that way. Or similarly, things like diarrhea in any species, but realizing that if you're taking care of an animal that's sick or with diarrhea, that has the potential to spread to you through a variety of ways. It can be through fecal matter, but also through, if you're cleaning and aerosolizing any of those bacteria or pathogens that are in that diarrhea, you can actually inhale it and contract it that way. So really important part of kind of spreading and raising awareness on those zoonotic diseases. As I mentioned earlier, we are also very involved in disease outbreaks. So oftentimes we can get called to kind of large cases of animals getting sick and identifying and addressing some of the causes of these illnesses and sometimes mass sudden deaths. So, being part of that prevention and containment aspect as well, and in terms of preventing these outbreaks, but also once they occur, how do we contain them and what's the cause of that? So in terms of things like we can see toxicities. So is there environmental contamination with things like lead, or are there certain plants that are causing, these grazing animals to get sick? Can all be part of that role in managing disease outbreaks. And then in terms of, things like drought and water insecurity, a lot of times we can see animals, having mineral deficiencies or things like salt toxicity as their water supplies start to dry up. And then finally, there are diseases that are reportable. So working in Canada, that we don't have certain diseases here. And so if they do start to pop up, being aware of what those diseases look like and being able to recognize and report the appropriate authorities when they do occur. And then one thing I think of also is very important for veterinarians, specifically in One Health, would be responsible prescribing and dispensing. So as a veterinarian, I have a responsibility to make sure that what I'm sending out to the door with my clients is appropriate for the disease and the animal that they're treating. So not every drug can be used in every animal. And when we look at that food safety aspect of making sure that that drug is safe to be used in that animal, that might end up in the food chain, and knowing how long that medication will sit in the body, and making sure that by the time it goes to market, it's no longer going to be in there. And so there's often a huge component of having those discussions with livestock owners in terms of them being aware of what they can and can't use and how they need to proceed, in treating certain diseases. And then I also think of it in terms of antimicrobial resistance. Antimicrobial resistance is a growing public health threat and concern. And so, we prescribe antibiotics every day. And so being aware of what we're using and how that's going to impact, the resistance that's out there, and making sure that we are choosing antibiotics that are safe and appropriate and making the best choice possible. And then veterinarians can be involved quite heavily in animal welfare. And so that has a significant impact on animal health. And I know a lot of people, might think, why does this relate to One Health? So when I think of it in our livestock and our grazing animals, or even in wildlife, animal welfare or the animal health can often be a good indicator of what's going on in the environment. So what food supplies are looking like, what's going on in terms of the grazing and the forage that's available to these animals, and can also be an indicator of certain housing conditions. I also think of it too in terms of, animal welfare. If we're seeing neglect or abuse cases, those can often be and have been directly linked to signs of, abuse in humans. And so being aware that maybe, animal welfare, or if you're seeing poor animal welfare, can be an indicator of larger changes going on that you need to be aware of, and potentially need to be addressing, or helping people find support for. So that, taking all of that information, and this is kind of what I practice in my day-to-day as a veterinarian here in Canada. But I wanted to kind of expand and start working, and carrying it more globally, and looking at different opportunities. So I ended up volunteering with Veterinarians Without Borders for 2 months this past summer. And I worked with the VETS program. So the volunteers engaged in gender responsive technical solutions. And the main goal of that program is to improve the economic and social well-being of the world's most marginalized people, so particularly women and girls. And Veterinarians Without Borders works in 6 different countries with this project across Africa and Asia. And so I was lucky I got to be able to go to Vietnam for 2 months this past summer. While I was in Vietnam, I worked with the Institute of Environmental Health and Sustainable Development. And so I worked on a few different projects while I was there. I got to work on a project on antimicrobial resistance that examined kind of the knowledge, attitudes, and perceptions and uses of antimicrobials by farmers in northern Vietnam. And so we kind of evaluated them on their antimicrobial use and their practices. I also got to be, and kind of the main project I worked on was a training program to train community animal health workers in 2 different communities in just north of Hanoi in Vietnam. And I'm going to touch a little bit more on that as I go forward. And then finally, I was also really lucky. I got to do a presentation to some veterinary students, a part of the Vietnam One Health University Network. And so I talked a lot about them, about One Health and animal welfare. And it was a really great opportunity to see how excited the veterinary students over there are about One Health and about improving One Health and animal welfare in their communities. So we had a lot of discussions about how they can do that just even in small scale where they live and they work. So our small scale farmer training program, so we recruited 30 small scale poultry farmers, and they were to be attend a training program designed to train them as community animal health workers. And as William talked about, these are important. Community animal health workers are really important in terms of, not everyone has access to veterinary care. And so by providing and training community animal health workers, we can increase, the ability of farmers, especially in rural or remote communities, to have, more access to a trained animal health care professional, and hopefully that helps them improve their ability to treat and manage diseases that they're seeing with their livestock. So with the program that we did, and aligning kind of with the VETS program goals, our goal was to recruit over 50% of the participants to be female. So we recruited about 19 out of our 30 participants were. And as I said, it's spread over 2 different communities in northern Vietnam. And so participants got to attend a 3-day training course that focused on a few different topics. So poultry production is really big in Vietnam. So we mostly focused on poultry production and strategies around animal husbandry and appropriate animal poultry raising strategies. And then we focus pretty heavily on things like biosecurity, as that can be a huge helper in terms of preventing disease spread and managing disease outbreaks. And then when we do have that, looking at things like disease prevention, so vaccines, and then disease management. So, accessing community animal health workers or veterinarians, or looking at what type of antibiotics or medications they're using. And then to assess how we did this, we did a pre and post training knowledge and skills assessment. So we looked at, the immediate takeaway that they took from the training program. And then kind of long term, we're doing pre and post interventions assessments. So that's where we were on farm and looking at kind of what their biosecurity and animal husbandry practices were on farm and what their strategies were. And then kind of a year after the training program takes place, the Institute of Environmental Health and Sustainable Development will be looking at going back out and reassessing and seeing kind of the long-term effects of this training program, and hopefully seeing what's translated into changes in their biosecurity and their poultry production practices on that farm. We did have some success kind of with our initial assessment. So we found that participants actually they improved their scores from 35% from before the training course to 81% on the average score after the training course. So, it's really positive to see that, knowing that they definitely took something away from the training course immediately. And then hopefully, as we see when that post assessment or that post intervention assessment is done kind of in next spring, seeing hopefully that's translated to changes in their own biosecurity and poultry management practices. And so kind of what are the next steps for that project? So the community animal health worker groups continue to meet with IEHSD on a quarterly basis. And so the group there continues to support them in terms of discussing new concerns and new issues that are arising for the community animal health workers and farmers in those communities. But the goal is to essentially establish a self-sufficient group that's able to come together on their own and share ideas and knowledge, and kind of work as a community and build off each other's experiences without necessarily the need for structured organization from the Institute of Environmental Health and Sustainable Development. And so it was really, from my experiences, it was really good to be able to get to go over there and share and learn about what a lot of the challenges that those farmers are facing, and take some of my own experiences working here in Canada and translate them into being able to support them with, information on biosecurity. And I think, biosecurity, simple things like hand washing and cleaning, segregating animals that are sick from healthy animals are all, we do them here, and they're kind of universal in that they can really help prevent disease spread. And so hopefully that can help make significant, or help improve some of the issues that they're facing there. So I just wanted to thank you all for having me speak today. It was kind of a privilege to be here with you all, and thank you for your time.
Great. Thank you, Regan. So now with that, we're just going to jump into some questions that have been passed along from participants. The first one is for you, Will. The question is, what is your advice on how to find the A-type farmers at the village level? These would be the best farmers with a natural gift of understanding good animal husbandry.
Yeah, it's a good question. So I think in many of the communities that I've worked in, there's often there are often livestock keepers who are the people that other livestock keepers go to for support. If you have a cow that's a difficult calving in a cow, you go to this guy. Or this woman, and so that's, I guess, what we try to do with the community animal health worker is kind of is to use that existing mechanism and strengthen it. So using the existing knowledge that these livestock keepers have, and building on it with modern techniques and the sort of as much of the latest science as possible. And one of the challenges is that quite often those people they tend to be older, and they're often they're not necessarily literate, which obviously presents challenges for training. I mean, it's not necessarily a complete barrier, but it's a challenge that we have to work around in our training. So I think the type A farmers, kind of livestock keepers, already exist in many of these communities, and it's just a case of trying to find them. These are the people that the communities usually identify anyway.
Great,
Good.
thanks, Will.
I don't know if there's anything you wanted to add to that.
Nothing from my side. I don't know if Regan or Julie, you'd have anything else you want to add on that question?
Nothing from me.
Okay, great. So then the next question is for you, Regan. It's asking, can you name the first or the three most important tasks of a veterinary professional in light of a One Health framework?
Okay. Yeah, that's a good question. I think in light of kind of a One Health framework, I think a huge part of that, kind of maybe the top one in my mind would be, education in terms of, educating your clients on how to treat and prevent diseases in their herds, and focusing on things like biosecurity and appropriate drug use are all really important. So I think as a veterinary professional, kind of one of your big obligations is to be able to educate the clientele or the people that you're working with on what these animal diseases are and how they spread, and how to kind of manage those aspects, because as a veterinarian you can treat the disease and you can provide medication, but if you don't address the kind of the more of the root causes of it, then it'll just continue and you get a perpetual cycle of my cows keep getting sick and we keep treating it with this and it clears up and then it comes back. So I think education is probably one of the most important ones. In terms of a kind of another important task, I would say, looking at, disease surveillance. So being able to monitor and, diseases and know what's going on in the community you're working in. So kind of for an example from me, right now in Southern Alberta, we've got a lot of drought going on. And so a lot of the clients and livestock producers that I work with are struggling with feed. And so, feed issues in terms of that how to manage their feed supply and other things like mineral deficiencies, all of that. And so by being able to kind of watching things that are going on and then educating yourself on them, you can kind of then be better able to know and advise your clients on what's happening. So I think that's also an important aspect. And then I would say kind of that third aspect would be, itself, and then providing treatment and biosecurity information. So, really yourself making sure that you're treating diseases appropriately, but then also that you're practicing good biosecurity and making sure that your clients are as well. I think that kind of answers your question.
Yes, you got a response that says, thanks, Regan. Education first is a great idea. Then we have more of a general couple of comments. So I'll read them out and open it up if anyone would like to feedback on the comments. So it says, not a question, but a couple of comments. We need to break the link with farm animals in the domicile, example, poultry, pigs, etc. And we also need to consider the transmission of diseases to farm animals. And thirdly, it would be interesting to see a year or two after training how many people are really applying good One Health practices when partners are not around. So I'm not sure if you guys would like to comment in response to that.
Maybe I can just share a couple of quick reflections on, I guess, the breaking the link with farm animals in the domicile. I think, again, there's a lot around hygiene and behavior change. What happens in compounds in the home with children, touching things. There was a study just last week at a conference, a water sanitation conference, around monitoring children's behavior, what they're touching in the family compounds, touching soil or feces that may be on the ground and picking it up and such. So there's a lot around hygiene and behavior change and those targeted behaviors that, awareness isn't always going to do it. So what are the methods for behavior change? in that separation in the home, because it really speaks also to the environmental health and environmental cleaning, I guess, in the compound, and what more so kids, but not always, obviously, but kids maybe picking up in the family compound. So I think I'll stop there from my side of things on the wash front, but pass it over to the others for further comment.
Yeah, I think those are all kind of really, really good comments as well, in terms of, like Julie just talked about how things can be transmitted, and then how interact, practices that you do in the home can affect kind of all aspects of on the farm, then the livestock health can all be incorporated. Kind of in regards to that third comment, it would be interesting to see a year or two after training how much people are really applying good One Health practices. I definitely agree. I think it would be really interesting to see, specifically even just with the training program we talked about, to see what 1 year down the road we're going to look, but is that going to translate into 5 years down the road? Is it going to get passed on to the new farmers that are coming in? And so that would be a really good place to kind of look at a further study down the road. The goal for the training program was to hopefully have it be able so that the community animal health workers could then go back to their homes and teach their kids about it. But again, that's a hard aspect to measure as well, and so it would have to be kind of an examination of what their One Health practices are 1 year down the road, but maybe 5 to 10 years down the road. So I think that would be a very interesting thing to look at as well.
Yes, thanks, Julie and Regan. Those are great points. And all we can say is keep following Veterinarians Without Borders for those impacts as we continue to monitor and evaluate our programs down the road, and we'll keep you updated as we see those impacts. So I know we're a little over time, so I'm just going to ask one more question to the group, and then ask for everyone just to share a summary statement, and we'll wrap up. So the final question is, what are the main challenges you encounter, one, in collaboration with human medical doctors, and two, at the community level in terms of animal and human health linkages? So I'll open that up to the panelists if there's anyone that would like to tackle that question.
I can have a crack at the first one. It's a collaboration with human medical doctors. I think one of the it's getting a lot better, and particularly since COVID, what One Health is kind of has become much more mainstream. But I think a challenge that I have encountered is just kind of a lack of awareness about the potential contributions of livestock to human health and well-being more broadly. I think many medical doctors kind of have vague memories of zoonotic disease from their lectures in the past, and then they kind of forget about animals. And so I mean, going back to my presentation, I mean, there's one of the big areas that the veterinary sector needs support in is health system strengthening, and that's an enormous field in the human medical sector. And so it would be amazing if there were human medical doctors or experts in health strengthening in that field, who are willing to jump over into the animal health sector to provide support. I mean, that would be an enormous step forward, I think.
Great, thanks, Will. So with that, I know there's a lot of questions coming in. What I can propose, since we are not going to have time to answer all of the questions, is that for all those registers, we can always do a nice little written summary to answer these questions for you and to send them out in a little Q&A format, so that you can have your questions answered by our panelists. So although we'll be stopping the questions right now. Please, if you have more that are unanswered, as well as the ones we weren't able to get to today, please just send them in and we'll send it through as a written follow-up to this webinar. So with that being said, I just want to pass them maybe to Julie first, just for a closing summary remark before we wrap up this webinar.
Oh, thanks very much. Thanks for the discussion. I'm learning so much from this, so thank you. Really enjoyed the discussion, and I guess I would just put out there as well this environmental pillar and strengthening that. I think it really, when we're facing climate change and everything related to the environment, I think does have implications for health, human health, animal health, and strengthening that pillar of One Health is really, to me, that's one of the major challenges I think that we face in the approach. So thanks very much.
Thanks, Julie. Over to Regan.
Yeah, thank you all for being here and attending, and these are some great questions coming in. I think it's really good to just see people engaging with One Health and learning more about it and wanting to learn more about it, and understanding that there's so many different components that play into it and different roles. So just recognizing the importance and the contributions from all the different fields that are out there and what they could potentially contribute in terms of One Health and the work that Veterinarians Without Borders is doing.
Great, thank you. And over to you, Will.
Well, I guess just to get back on my soapbox, I'd say that animal health systems are the strong and effective animal health systems are the only way we're going to tackle many of the world's greatest challenges, like climate change, AMR, pandemic disease emergence, and poverty alleviation. And they're not strong enough at the moment, and they need to be much stronger. So I'd encourage anyone who is working in this field to keep focusing in on this area, and any funders out there to keep funding the work around animal health system strengthening.
Great, thank you, Will. Thank you, Julie and Regan. Thank you for your great presentations today. We really appreciate it. It's really prompted some great discussion. And although we do have to wrap up today, for all those who have attended, thank you for your participation. We'll follow up with the remaining answers to questions that have been submitted, as well as there'll be a recording of the presentation for those who've been asking for the recording and the slides. So with that, I'd like to thank everyone for your time, and we appreciate your ongoing support and engagement in One Health. And we look forward to continue increasing programming in this area. So thank you, everyone, and enjoy the rest of your day. Bye.